News editor Kate Nagel. Thanks for joining us for the 4 o'clock news and politics show. We've had a full one so far, and I'm very excited to welcome my next guest in, Ruthie Fetter, the Executive Director of the Mental Health Association of Rhode Island. Ruthie, thanks for coming in today.
My pleasure.
It's at the end of April now. You're gearing up for a big month in May. May is Mental Health Awareness Month, and there are going to be a number of events and activities taking place around the state to bring awareness to mental health issues. So talk with us a little bit about the overview of what you're looking to achieve in the month and maybe some of the nuts and bolts that folks should know while we have you here.
Sure. Well, first of all, we have our kickoff of May's Mental Health Month on Tuesday, May 1st at the State House and State Room, and a number of dignitaries will be present. The theme of the day is mental health parity. Behavioral health parity, which means substance use disorder and mental illness. And so at the kickoff, we want to start raising people's awareness about what does that mean? What does it mean if there is a parity, P-A-R-I-T-Y, violation? And through the year, it's sort of at the kickoff because the Mental Health Association is going to be spending a lot of this year raising awareness on this issue. But in addition to the kickoff, where there will also be 2 people who have lived experience with mental illness. They will also be presenting. We will also be giving a leadership award, a legislative award as well. The month contains numerous activities from all over Rhode Island. We have a planning committee that gets together from many, many organizations around the state. They come together, we end up, each organization plans an event, and that's this calendar, which is available on our website, mhari.org. And some of the items, some of the classes require registration, some don't. It's all there. If there's any problem, you can always call our office, 401-726-2285. But there are numerous classes, workshops, seminars that should be of interest to many, many people because mental health, substance disorder is rampant. Every family either has experienced it themselves or knows someone who has.
And so the whole month of May, we'll provide that link to the calendar as well. All these events taking place around the state, again with the big kickoff taking off on May 1st up at the State House. Let's talk about where things stand. Let's talk about the parity issue.
Sure.
I know it's big for families, it's big for insurers, you know, folks addressing it as the health need that it is. Have we been making strides from a health industry standpoint to make sure that substance abuse, mental health, again, gets the coverage that is needed from a parity standpoint?
Well, it's a good question. The state of Rhode Island has a mental health parity law. When I use the term mental health, I also mean substance use disorder. Federally, Patrick Kennedy was behind promoting and getting passed a federal parity law. They're wonderful laws. There's not 100% compliance on the part of health insurance companies.
Okay.
So there are a lot of people in the state working on this. The Office of Health Insurance Commissioner is doing a review. We're not looking to get insurance companies to comply. We're looking to get the word out so people understand what does mental health parity mean. And what it means is that any treatment or services for mental health or substance use disorder have to be the same as you would get for a medical surgical problem. They can't be different. It's like a balancing act. They have to be the same. If you get mental health benefits, they have to be the same. So we want to raise awareness because, in answer to your question, there are still issues. There's legislation pending in the legislature right now. It's an ongoing effort.
Again, to keep bringing attention to the issue, to the parity issue. And where do you think things stand, Ruthie, in 2018 in terms of recognizing the need to address mental health, to also look at destigmatizing the issue, which has been something that groups have been working on hard now for decades? Where are we in 2018?
Well, first of all, this year, right now, the governor has made mental health a priority. That's really important to get the word out there. It makes a statement that this is not something to hide from, but there still is a stigma. People are still afraid. If they're depressed, they're afraid to call their employer and say, I have to be out because I'm really depressed. They say I have a cold, I have the flu. We want to change that. It is 2018. It's time for that to be over. Mental illnesses are not make-believe. They're not voodoo. They're real. They're illnesses. They're biochemical. And we want to get the word out that it's time to move on.
And then let's talk as well, especially among youth. Let's talk about mental health and what we see in the schools, what we've seen with school shootings. A lot of talk about addressing the mental health needs of students and families. You're the executive director of the Mental Health Association of Rhode Island. If families have concerns about their children, what's the first step? Is it the primary care doctor? What's that first step when you said we might need to get help?
Probably, if a school has an involved, engaged counselor, that would probably be the first place to go. But there are some families who don't want the school to know. That gets back to the stigma issue. I'm hoping 5 years from now, this conversation will be different. But if they don't want to go to the school counselor, the primary care physician is the next step, unless they already have a relationship with a mental health professional, in which case the best thing would be to turn to that professional. But barring that, then the primary care provider, whether it's a pediatrician, a family doctor,
that's where to start as well. And let's talk about the substance abuse side of things as well. Again, going hand in hand with, I'm going to bring you a little closer over here, with mental health issues. Again, has that awareness level been raised to put the two issues together?
I think that with the tragic opiate crisis that we're experiencing, not just in this state but nationally, I do think people are very, very aware of the problem, and they're very eager to solve it. But part of solving it is looking at not just let's solve this current problem, let's look at how did we get here? And we need to do prevention at a very early age.
So while I have you in here, again, we're going to provide this link to all the events going on around May, but give us a little sense about what some of them might be and who might be interested. Feel free to go to your cheat sheet. I
have my cheat sheet. Well, I'll tell you first about a couple that our organization itself is sponsoring. One is entitled Recentering, Quieting and Calming the Mind and Body in Turbulent Times. And that is being put on by a licensed massage therapist who specializes in light touch mind-body modalities, a yoga and meditation educator, and a psychologist. And the focus is to learn how to change the way your body and mind respond to stress and physical and emotional pain, which is excellent.
I can't imagine anyone who would say that that doesn't sound like something they might need.
We all need it. Then another one that we are putting on, we just talked about Parity. We talked about discrimination for people with mental illness and substance disorder. Sam Selganic, who's an attorney at the Rhode Island Parent Information Network, and I are going to co-lead a training, a workshop for healthcare providers, office staff, patients who want to know how to recognize a parity violation, what to do, where to go, what the next step is.
That's really putting the advocacy hat on there.
That is right.
And again, bringing in everyone in the healthcare community. Again, so many events taking place in the month of May. We'll provide that calendar for you on GoLocal after. But Ruthie Fetter, I appreciate your taking the time. As May is, we look outside, hopefully just around the corner here, but lots going on with Mental Health Awareness Month, so appreciate your taking the time to come in.
Thank you.
Thanks so much.
Sure.
Don't go anywhere. We'll be right back. Former U.S. Senator Lincoln Chafee.